The Nigerian Communications Commission has confirmed that several African internet service providers faced outages due to submarine cable cuts, with cable operators actively engaged in efforts to restore connectivity. The telecom regulator made his disclosure in a statement signed by the Director, Public Affairs, Ruben Moka, on Thursday. The NCC identified affected operators to include West African Cable System and African Coast to Europe, along with SAT3 and Main 1, which experienced downtime. The regulator attributed the disruptions to incidents in Côte d'Ivoire and Senegal, resulting in subsequent disruptions in Portugal. The Commission noted similar challenges along other undersea cable routes, such as SEACOM, Europe-India Gateway, and Asia-Africa-Europe 1, which also experienced cuts. Many subscribers on Thursday expressed frustrations on social media in making phone calls and accessing online services. Despite the setbacks, the NCC assured the public that cable operators have initiated repair efforts, with services gradually being restored. And following the recent kidnappings in Kaduna State and the demand of 4 trillion naira as ransom by the bandits, Islamic cleric Sheikh Ahmad Gumi has suggested that the government should have a dialogue with them rather than pay any ransom for the victims' freedom. In an interview monitored on Arise News on Thursday, Sheikh Gumi said the bandits only pitched the ludicrous amount of 1 billion naira ransom as a bargaining tool. He also said there is need for a change of approach by the Nigerian government to issues of banditry and terrorism.
What's happening now, especially we are seeing that these bandits are getting more and more vicious. Before, they don't do what they do now. They are heading to softer targets, as the military man has said. We can only attribute that to the kinetic approach, which is overemphasized. When we hear even politicians talking about the non-kinetic, but nothing is done about to overcome these people. Let me give you an example. Now we are fighting bandits. They are anonymous. They are phantom. How can you fight somebody you don't even know? We said, let's go in, let's know them, let's map them out. Map them means know who they are, where they belong, and what are. All this intelligent information is virtually not there. How can you know somebody from satellites, from drones? And the harsh, high-handed approach to the matter is what is making it worse. Now they are kidnapping small children, and they are threatening death, which they don't do before. So I think what we need to do is generally go back to the drawing board and truly be non-kinetic. Hamas are sitting down to exchange prisoners. I don't see why we cannot negotiate. If America can negotiate with Taliban, I don't see why we cannot negotiate. They cannot impose on us their own ideals when they, behind the door, they also negotiate with these terrorists.
287 students and teachers from the LEA Primary School and the Government Secondary School, Kuriga, Kaduna State, last week have demanded 1 billion naira for their release. The hoodlums who made the demand also gave a deadline that would elapse on March 27, 2024 for the payment of the ransom. There was reports on Wednesday that the bandits contacted a spokesman for the families of the hostages on Tuesday and demanded the ransom. On March 7, 2024, the school children were abducted by the hoodlums who took them into the forest. Report says that a community leader, Jobro Aminu, who acted as a spokesman for the families of the hostages, said he received a call on his phone from the kidnappers on Tuesday. The recent kidnappings in the north have led to the captivity of about 493 children and adults in Kaduna, Borno, and Sokoto states. Away from the north, let's take you to the southwest now. The Olubadan of Ibadan land, Oba Lekon Balogun Ali Okumade II, is dead. He was aged 81. Oba Balogun spent 2 years on the throne of his forefathers, having been presented the staff of office by the Oyo State Governor Seyi Makinde on March 11, 2022. Confirming his death in a statement by his Chief Press Secretary, Suleiman Olanrewaju, on Thursday, Makinde said Oba Balogun died Thursday evening at the University College Hospital, Ibadan. The governor described the late monarch as a towering figure akin to an Iroko tree. The late Olubadun was born October 18, 1942. The Olubadun ascended his forefather's throne 2 years ago after the passage of the late Oba Saliu Adetunji. On Monday, the late monarch thanked God for the grace and privilege to clock 2 years on the throne, just as he thanked members of his advisory council for their unflinching support so far. And President Bola Tinubu has appointed Dr. Temitope Ilori as the new Director General of the National Agency for the Control of AIDS, NACA. Ilori, who is the first female to be appointed the Director General of the agency, began her initial term of 4 years on February 22, 2024. The head of Public Relations and Protocol of NACA, Toyin Adiribigbe, made this known in a press statement made on Thursday. Ilori took over from her predecessor, Dr. Gambo Aliyu, who was the DG of the agency from June 2019 to February 2024. Up until her appointment, Ilori was a senior lecturer in the Department of Community Medicine, University of Ibadan, and a consultant family physician in the Department of Family Medicine, University College Hospital, Ibadan. She obtained her MBBS degree from the University of Ibadan and her other residency training at the University College Hospital, Ibadan, Nigeria. She graduated as the best graduating fellow of the Faculty of Family Medicine, West African College of Physicians in April 2012, winning the A.O. Shebanjo Prize. She's also an associate fellow of the National Postgraduate Medical College of Nigeria. Now let's take you to the National Assembly, where a major rejig of the student loan scheme of the federal government has been proposed for legislation. The new plan will ease loan access by students. It was sent yesterday as an executive bill to the Senate and the House of Representatives for consideration and passage. March 14 would have been the official kickoff of the program, but it was shifted indefinitely. The new bill seeks to scrap the Student Loan Act, which is to be substituted. President Bola Tinubu on June 12, 2023, signed into law the Student Loan Bill to provide interest-free loans to Nigerians seeking higher education. It was sponsored by former House of Representatives Speaker Femi Gbajabiamila, now Chief of Staff to the President. The bill was introduced in 2016 as part of measures to address the funding gaps in tertiary education. The new bill got expeditious consideration at the two chambers. It spells out the funding structure and other conditions attached to the loan. The bill, which scaled the first and second reading on day one, proposes 1% of all collectible revenue by the Federal Inland Revenue Service to fund the scheme. The hurdles of a guarantor, a parent's debt profile, and others in the old act have been removed in the new bill, thereby making it easier for the loan to be accessed. Still in the National Assembly, the Senate on Thursday called on the federal government to expand its coverage of the National Health Insurance Scheme to cover patients with chronic kidney disease. It also urged the federal government and other stakeholders to launch extensive public awareness campaigns on kidney disease prevention, risks, and unavailable treatment. The Senate's resolutions were sequel to the adoption of a motion sponsored by Senator Abdulaziz Yaradua, APC Katsina Central, under personal explanation during Tuesday's plenary. In his presentation, Yaradua said recent statistics from the Nigerian Association of Nephrology revealed that 25 million Nigerians were living with kidney diseases.
It is imperative to note that we are faced with a critical healthcare challenge in Nigeria. Recent statistics from the Nigerian Association of Nephrology reveal that an alarming 25 million Nigerians are living with kidney disease. This calls for urgent attention to address the prevalence of this life-threatening condition and improve kidney treatment facilities in our country. Reports that chronic kidney disease constitutes about 40% of referrals to tertiary hospitals in Nigeria and is a significant contributor to daily hospital admissions. Finds that the cost of dialysis session in Nigeria ranges from 20,000 to 50,000 per session, leading to low adherence rate due to financial constraints. Further finds that the alternative to dialysis, which is kidney transplant, is financially unattainable for many, with the cost exceeding 6,500,000 naira. Aware that the National Health Insurance Scheme in Nigeria provides limited coverage for chronic kidney disease patients, highlighting the need for expanded insurance coverage to support this treatment. Notes that the federal government and other stakeholders must launch extensive public education campaigns to raise awareness about kidney disease prevention, risks, and available treatments.